You're my everything, all that I am, all that I'll ever be is a result of who you are to me. My heart's desire is to do your will, to pursue your purpose, your plan fulfilled. My soul's delight is to follow you. My goal, my purpose is your will to do. All that I am, all that I'll ever be is a result of who you are to me. All that I want for people to see is the image of I am in me. Every day I live to see. I thank you, God, because you let it be. The breath I breathe is life to me. Everything you are is what I wanna be. Yeah, yeah. All that I am, all that I'll ever be is a result of who you are to me. All that I want for people to see, yes, is the image of I am in me. All that I want, all that I'll ever be is a result of who you are to me. Yeah. All that I want for people to see, yes, is the image of I am in me. Yeah. Oh, is the image of I am in me. Is the image of I am in me. Yeah, yeah, yeah. Is the image of I am in me. You are, you are, you are, you are.
It's Friday Night Live with Cat Carter. Get ready, set, let's go. Come on. It's Friday night. It's Friday Night Live. It's Friday night. It's Friday night with Cat Carter. It's Friday night. Hey. It's Friday night. It's Friday night. Yeah. It's Friday night with Cat Carter. It's Friday night. It's Friday Night Live. It's Friday night. It's Friday night with Cat Carter. It's Friday night. Hey. It's Friday night. It's Friday Night Live. It's Friday night with Cat Carter. 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 With Cat Carter.
Hey, welcome to Friday Night Live. I am your host, Cat Carter. How is everybody doing this evening, this wonderful Friday evening? You know where I live at, it's like 74 degrees and sunny. That is my weather. Oh, yeah. Well, I am so excited tonight. This subject is very dear to my heart. I am a scientist. I am in the medical field. All this month, we're going to be talking to doctors and doctoral students. And tonight, I have one of my longtime friends and favorites, Dr. Ronald Rembert, who we know who that is. And we have Dr. Caylon Pettis here. Oh my goodness. And we're going to be talking about their journey. We're going to be learning about some of the challenges of getting into medical school, why medical school. We're going to be finding out all kinds of wonderful things. So if you are interested in going to medical school, if you have a relative or friend, call them right now. Tell them to get here right now because we have some really good information that we're going to give you all tonight. So Friday Night Live is a positive platform where we inform, innovate, and inspire. So I want to welcome to you tonight Dr. Ronald Rembert Jr. and Dr. Caylon Pettis. Wait. Okay, there's Dr.
There we
Rembert.
go. Cool.
There it is.
Yeah.
I got so excited, I think I hit the wrong button.
Uh-uh.
How are you gentlemen doing?
Doing good. How about yourself?
Doing good? Doing wonderful. I am just so excited now that you two are here. Dr. Pettis, can you hear me okay?
Yes.
I can't hear you. Say hi.
Hello, can you hear me?
I can't hear you. No. I can hear you now. Okay. All right.
Perfect.
All right. So just to get started, first off, I know that you all have a very busy schedule, and I'm just thankful and honored just for you all to be able to make the time to talk to us tonight about medical school. So with that, just to get started, I wanted you two to briefly tell us a little bit about yourself, what medical school you went to, and then what residency you went to, and what is your specialty.
Okay.
Dr. Rembert, you go first.
I went to the Chicago Medical School at Rosalind Franklin University. Graduated from there 25 years ago. Wow, it's been that long. And my specialty is family medicine. Had the opportunity to work in federally qualified health centers for a number of years, and then worked as a consultant with various healthcare organizations all over the United States.
And then I'll go. I graduated from Loyola University of Chicago. I actually did a dual degree program there, a Master of Public Health and my MD program. And then I matriculated into Mayo Clinic's residency program, where I'm currently a psychiatry resident, second year. So it's just a pleasure.
Congratulations on that. Oh my goodness. Wow. All right. So just out the bag, what motivated you two to pursue medicine, and were there any specific experiences that confirmed your path?
Well, for me, I wanted to be a physician ever since I was a child. When I was 7 years old, my father, he passed away. He served honorably in the United States Navy, and unfortunately was exposed to Agent Orange while he served in Vietnam, and died from complications of heart disease at the age of 32. And that kind of lit the fire for me, making sure that I didn't want anyone else to ever experience what I and my family had to go through. And that helped focus me, because I always was interested in medicine, but after that, I had even more impetus and more desire to go into it to help others.
For me, I kind of developed my passion for going into medicine. I didn't really believe when I was in high school and college that I could be a doctor. I worked at a pharmacy as a pharmacy technician at Walgreens, and so my path was going to be a pharmacist. But one of my best friends ended up convincing me to apply to med school because he saw a lot of the advocacy that I was doing in college, and then really I just fell in love with the science. Science has always been something that I really loved, and I had a lot of mentors early on that really encouraged that STEM exploration early on. And so I knew I really liked science, but I needed a community to kind of push me toward this physician role that I have today.
All right. So I know that the MCAT is like a major exam, the MCAT. What advice would you give someone to prepare for that test? Because that test, I tried to take that test. Oh my gosh.
I could take that. I think number one, you need enough time. I think that you have to have at least 10 to 12 weeks of a consistent plan. After you figure out that time block, you need to plan accordingly. And so what that really looks like is having a set number of practice exams that you're taking so that you can kind of see where you are periodically. If you put those tests too close together, you're risking increased levels of burnout. So you kind of have to pace them in your own pace. And if you have an extended amount of time, I will spread them out further and then kind of have them closer together when it's closer to test day. I think a big aspect of it as well is, how do I study for the MCAT? Because a lot of times you're just kind of thrown into this. You have this desire to want to be a doctor, but you really don't have a lot of the guidance sometimes to figure out, is this a correct MCAT study schedule for myself? I think a big thing that was helpful for me is finding someone who has taken or has been successful with the MCAT and seeing how have they been able to be successful. I think there's a lot of resources like Anki, which is this time repetition flashcard app that you really wouldn't know about unless you're in those circles. Two, I think that you have to end up doing a lot of questions. I think a lot of times I've heard people when they study for MCAT, they do a lot of reading, they do a lot of videos, but if you're not doing the questions, you're not applying that knowledge, especially in the specific way that you're going to have to apply it for the MCAT exam. I think that you also have to build your endurance. It's a long exam. And so you build that endurance by having those practice exams and doing those things and kind of sitting down for those extended periods of time and seeing how much energy that takes out of you. Because I think a lot of times I've seen people not take those full length exams, practice exams, and then they end up getting tired out. They can't continue to read in the same way they were reading on the first block, and then they get more tired. And then lastly, specifically, because I know that a lot of people have issues with the CARS, the critical reasoning portion of it. One thing that was helpful for me, every day I would read a New York Times or Washington Post article. I think that you have to incorporate that reading into your schedule, because reading comprehension is something that you have to build. You can't just test for it, if you will. You have to kind of build a lot of that understanding of the jargon that they use within those scientific papers, and then understanding what is applicable with those things.
Okay. How did you two decide which medical school programs you wanted to apply to? Go ahead, Dr. Rembert. You can go first.
Well, for me, my story is a little bit different. I was accepted in the UIC's medical school and told I had some of the best credentials in the state by one of the deans there. But that dean ended up subsequently relinquishing or taking back the acceptance after an incident that took place at the school that basically, it was unfortunate. He, did some things that he shouldn't have done. And basically, I ended up going through a program at Rosalind Franklin University at the Chicago Medical School called the Pre-Matriculation Program after that. And this was a program that allowed us to, if we did well in these medical school courses, to matriculate into the medical school. So I ended up going to Chicago Medical School through the Pre-Matriculation Program, did successfully in that program, and then was accepted in the medical school. And then after that, matriculated through medical school successfully and went into residency. And then after that, started my career.
For me, when I was looking for medical schools, I was looking for a school that had a focus on underserved communities. I believe that a lot of different communities that navigate issues with poverty have a lot of different structural barriers that we have to be knowledgeable of in order to be able to help our patients. And so I wanted to go to a school that had a focus on that social justice aspect. And that's why I chose Loyola University of Chicago, because they were really focused on serving the underserved, but also thinking about how we can do these things structurally.
All right. So I know that you all have a great relationship as mentor and mentee, and I want to talk about that for a minute. Why is having a mentor important during this process?
Dr. Rembert, you mind if I take this one first?
Yeah, go ahead. Yes, please.
I'm going to be a little bit more animated on this part because I think this is something that truly means a lot to me. I think when you're trying to do something and you don't know how to do it, you need to ask somebody.
Yeah.
I'm going to say that again. If you don't know what you're doing, you need to ask somebody. And when you have somebody that you can throw a lot of these questions to, they can prevent you from making a lot of the mistakes that you would without that guidance. And I think a lot of times we're trying to navigate these fields, these professions, or any aspect, and we don't have the guidance or the wisdom of experience to be able to kind of give you a better perspective so that you can have a better plan about the problem. And I say that in relation to Dr. Rembert because I have been Dr. Rembert's mentee since about the first year of medical school. When we actually met at a Cook County Physician Association mixer, where he was supposed to be having another mentee, but they didn't show up. And so he was in a crowd of physicians, but really talking about the business of medicine. Me as thinking about I need to get paid and I need to figure out how I'm going to put food on the table, but also want to serve my patients, was listening or what I like to call ear hustling with him very hard because I wanted to know, how does this system work? A lot of times we don't know about the business of medicine as physicians because we a lot of times feel the calling of treating patients, but a lot of these different institutions require money. And so talking to Dr. Rembert, I told him that he has things that I need in order for me to be successful. And so that's what created that relationship. I do want to make one small caveat when it comes to mentorship. There are many ways that mentorship can present when it comes to your relationship. There's sponsorship, people who tell you about different opportunities and help you go to those. There are people who are more counselors who you can come with plans and they can try to, advise you on how ways you can navigate. You have people who are just in special niche fields that you ask certain questions to when you don't understand certain nuances of things. However, it is very important to understand the type of relationship you have with your mentor so that, number one, you stay within the boundaries of your relationship, but number two, so that you can make sure you're getting the most and utilizing that relationship. People are resources. People's knowledge and experience are resources. And the only way that you're able to access that is through that relationship.
Yes, sir.
Yeah. Dr. Rembert is definitely a walking knowledge through education and experience. I mean, you got a good one. You have a good one. All right. Dr. Rembert, did you want to piggyback on that? Or
Dr. Pettis, that's fantastic how you explain that. I look at it like this. If we aren't trying to replicate ourselves, we're failing. We have to raise up the next generations of leaders, whether in healthcare, education, politics, in all fields and walks of life. And if we're sowing into the people who are coming behind us trying to do what we're doing, we make sure that we have not only a continued supply of physicians, teachers, lawyers, accountants, politicians, leaders, but we're making sure that as we instill this in them, that the expectation is for them to continue to replicate themselves so that we can continue this going. A lot of times people get to where they're trying to go and then they close the doors behind them. And I hated that. I always hated that. I wanted to make sure that if I walked through a door, that I helped as many people to walk through those same doors as I did. I've got a picture up behind me that is one of my favorite pictures. It's a gentleman teaching a young man, and spread out before him on that table, he's got all types of books and wisdom and teachings. And in doing so, he's teaching and training him so that he gains that wisdom and knowledge that he has. And that should be the goal as a mentor. You're training and teaching those who are going to replicate you, and then one day not only take your place, but train up others so that we're replicating and multiplying in whatever field of specialty that we pursue.
Can I add just
That's
one
good.
thing
That's
to
good.
that?
Absolutely. Go ahead.
As a mentee, it is important that you execute what your mentor tells you to do. You say Dr. Rembert is a great mentor, and I agree with you. but Dr. Rembert is very hard on his mentees. Dr. Rembert would tell you, you need to go to this event and you need to be there and speak. Let me talk about me and speaking events. I used to not really like speaking events. Dr. Rembert was the one that pushed me. You're going to speak at this. You're going to speak at this. This is what's going to make you better. It hurts when you're outside of your comfort zone.
Yes.
It is uncomfortable.
Oh, yeah.
It's a very uncomfortable experience. But you have to follow the steps in order for you to get to the places that you need to be. And I think I've seen a lot of times people connect with great mentors, but they don't follow the steps. And that is what's been a lot of people's barriers when it comes to being successful when they find those great mentors. But there's also a lot of people who have not found great mentors, because a good mentor is really hard to find when someone cares about you.
Yes.
And so it's always good to treat mentors kind of like you're dating, or putting them in silos of what they have been beneficial for you, because I believe that you have to understand, like I said previously, your relationship with your mentor and what that means.
Wow, this is good. For those of you that are just coming in, we are talking about how to get into medical school. And we have Dr. Ronald Rembert and Dr. Caylon Pettis here. They're sharing their journey of how they got accepted and being successful in that program. Okay, and what makes a medical school application stand out?
I think there's multiple
That's for
parts
either
of
one
the
of y'all.
application that you have to end up paying a lot of attention to. When it comes to medical schools, your GPA is really what's huge. How well you're doing in your classes. That's going to determine whether you need to take a baccalaureate course, or you need to go get a master's in master's of science before applying to med school. So that's one of the big things. Another big thing is your MCAT score. You want to have a high enough score so your programs can look at you. The GPA and the MCAT are generally the big two things that people get screened out for. And so it's important for people to do well in school. And even if you didn't do well in school, there are also opportunities for you to increase your education so that you can reapply back to medical school. After you've passed those aspects, I think one of the biggest things is your personal statement. I think this is the only piece of literature, if you would, that's telling people about you specifically. I think when I've reviewed a lot of different personal statements, one thing that I've seen is that people a lot of times say, well, I did this, 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 and I did this. That is not a good personal statement. That does not tell me anything about you. I go back to one of my English teachers' frameworks is claim, evidence, commentary. You need to have a common theme about what aspect of myself do I want to present to the admission board? What do they want to think about me after I'm finished? After that, you end up having your claim. Hey, I did this, and this was an experience that I had. Evidence, this is what happened. Commentary, this is what I learned from this experience. And this is how this is helping me become a better candidate for medical school, such and such. I think your personal statement should reflect there's the list of events, and there's a list of things that you have done and criteria. I forget the name of it right now, but pretty much what have you been involved with? If you've been involved as SGA president, have you shadowed doctors? So you want to look at that list. So that list is comparable with your personal statement. Your application should ring seamlessly. When people see you, they know, oh, this person is interested in education, indicated by these different experiences that they have written down, but also indicative by their personal statement with them explicitly saying that. Or this person is looking to do a lot of things in research, given by the experiences that they have, and then also within their personal statement. So you have to make sure you're writing one story. A lot of times people have these fragmented stories, and then it doesn't read seamlessly as this is who you are as a person.
Okay. Dr. Rembert, what common mistakes do you see students make when applying to medical school?
Several. A, as Dr. Pettis mentioned, making sure that your GPA as well as your MCAT score are as high as they can possibly be. Schools look at those because those are very objective criteria that they use. And I say objective in quotes because, I mean, the GPA is how you've done in particular classes, but they're looking to see your GPA in, especially in the prerequisite courses, the biological sciences, the basic chemistry, organic chemistry, the physical sciences, and to see with the MCAT whether or not you can do well on standardized tests. Because once you get into medical school, you'll have to take the USMLE, the U.S. Medical Licensing Exam Parts 1 and Parts 2, or Step 1 and Step 2. And you need those to graduate from medical school. And these are major tests. The first part is given after your first 2 years of medical school. The second step, that last step, well, it's 3 steps actually. The third step is given in residency. But that second step you need during your last year of medical school, and you need to pass both to graduate from medical school so that you'll be able to participate in a residency training program. But the MCAT we look at because we're looking to see how well you can do on a standardized test under time constraints and basically under pressure, because when you take your USMLE test, these are timed exams, standardized tests, testing you on your knowledge and understanding of the basic sciences after the first 2 years, and then testing you on your clinical rotations understanding in those last 2 years. So you got to make sure that that MCAT score is preferably above 500, preferably above 505, to really make yourself competitive to other students in trying to get into medical school. And then on top of that, I recommend doing a study course. As Dr. Pettis mentioned, you have to do a lot of questions. The flashcards are excellent. When you're doing those questions, you got to time yourself. And I did this religiously. I took those practice tests and timed myself, but also kept track of the number or percentage of questions I got correct, so that the more of those tests that I did over time, I got quicker in being able to read and comprehend the questions, but also the percentage correct and accuracy also went up over time as well. But it takes time. You have to set time aside to study and prepare for each of these exams, because each of these exams are major tests that you'll have to do well on to matriculate into medical school, and with the USMLE test to graduate from medical school.
Can I just add another perspective to the aspect?
Oh, absolutely. I'm sorry. Yeah, go ahead.
And I think that is also important about STEM when it comes to elementary, middle, and high school. I think a lot of times we think about medical school as you get to a point and you apply, but this is building up from elementary, middle school, and high school. So it's important because a lot of times when you don't have those foundations, you end up struggling in those higher disciplines. And when you're struggling in those higher disciplines, you have to go back to the basics and try to figure out things that you should have already learned in order for you to start succeeding. And I've seen, even in medical school, there's a lot of my classmates that I've known that have had struggles when it comes to having to go back and relearn certain things. For me, I didn't take some of those classes that I should have, like physiology and anatomy. So I had to learn all of those different things first pass, which is something that you really don't want to do. But I think we have this conversation, but we don't emphasize how important it is for, encouraging and promoting our youth when it comes to our adolescents and our children in elementary, middle, and high school, and promoting these STEM programs there.
Mm-hmm. All right. Very good. Let me see. I think I want to take a break. I'll take a break right quick. We're going to listen to, for those of you that know Dr. Ronald Rembert, he also is a sensational saxophonist. And so we're going to listen to one of his projects. Also, I'm going to give something away tonight, and that'll give you guys a chance to rest. On the other side of this break, we're going to possibly take some questions as well, and we're going to go a little bit deeper. All right, so you all hang tight, and we'll be right back. Let me see. So are you all enjoying Dr. Rembert and Dr. Pettis? Yes, this is very, very good. This is very, very good. And you know what? Karan said something that was really good. She said, I'm enjoying this. These are nuggets that could be applied to any type of field or major. Yeah. Yeah. All right. So let's go to trivia first. All right, here is our trivia question. You have severe amnesia and was referred to a blood specialist who ordered more tests to decipher the specific type of amnesia. The what did I say?
Anemia.
Yeah, anemia. Okay. The specialist also ordered a blood transfusion and daily multivitamins. Which of these doctors deals specifically with blood problems? Hematologist, rheumatologist, immunologist, or radiologist? And I'm going to be giving away tonight a book, a med student's guide to getting in. And this is a step-by-step analysis of the application process and competitive application from a student's perspective. So if you know what the answer is, put it in the comments while we listen to Dr. Ronald Rembert. Dr. Renwood, that was beautiful. Amy asked, what was the name of that song? And go ahead.
More Than Anything. The song is titled More Than Anything. And I'm trying to
I was trying to remember. Is that Lamar Campbell?
Yes, Lamar Campbell. Yes.
And Spirit of Praise. Yeah.
Mm-hmm.
All right. So that's More Than Anything. Did you all enjoy that? Well, we are back and we are doing the medical school blueprint. That's what we're doing. I have Dr. Ronald Rembert Jr. and I have Dr. Caylon Pettis here, our special guest tonight. Okay, so at the beginning, we kind of talked about getting in, what it took to get in, like the process of that, the importance of having a mentor, even from the very beginning. What I want to talk about now is, now that you all are doctors, what are the biggest challenges of being a doctor that aren't immediately obvious?
Dr. Pettis, I'll defer to you first, and then I'll respond.
Man, that's a really good question. I think one of the factors that have been really interesting to me now, starting kind of my physician journey as a resident, is the education aspect. It's easy to know stuff, it's harder to explain it to people. And so I think one of the big things that I have been focusing on is, how do you break down a lot of these niche topics, and how do you talk to them in common and lay language in order for people to have more autonomy and make better informed decisions because they are truly informed about their medical care. So I think that's one thing that is quite hard, because you can make these medical decisions and have all of the evidence behind making these great decisions. But if you cannot establish that relationship with your patients, and if they don't feel like you are telling them the truth, or don't feel like you have the information, or if you're not explaining the information in a way that they can understand, a lot of times they'll be reserved.
Okay.
For many physicians and healthcare workers and just people in general, it's time management and work-life balance. Managing your time between your career, your family, your hobbies, your interests, and being able to do those things, but also doing what you love in your career to the best of your ability. I see so many physicians, nurses, and healthcare workers burning themselves out because we're so focused and dedicated to taking care of others. A lot of times we don't take care of ourselves. And you see more and more, physicians burning out, nurses burning out, physical occupational therapists burning out, healthcare workers across the board, where over time they've given so much of themselves that sometimes they have nothing left to give. I remember talking to this ER physician that I trained with at Cook County Hospital. And I actually wrote an article called Burnout that got published. But long story short, when I worked with him, I remember we were in the ER and we had a teenager who died from an asthma exacerbation. And we worked on her in the ER for a period of time and could not revive her. She had lost consciousness after she was hypoxic, didn't have enough oxygen to her brain and heart, and died in the emergency room. And I remember me and him after that, we walked together over to the cafeteria at Cook County Hospital to have lunch. And he just sat there with tears in his eyes. And, after what we just went through, it was understandable, but he said he just wanted to walk away from medicine. And I sat there encouraging him because I saw the number of people's lives he had touched, the number of physicians he had trained, the number of students he had taught, the number of patients by the thousands he had treated over his career. But in that moment of vulnerability where we had just lost a child, you could see just his heart not only going out to that family, as we had to explain to the parents that their child had just expired, but seeing how he was at that point where he was just ready to walk away because he had seen this one too many times. So having that balance between work and family and those you love and care about and your interests it's important because a lot of times we can give so much of ourselves that we don't have anything else left to give.
Okay. What are the good and bad or the pros and cons about being a doctor in your experience? I guess you kind of told us a little bit about the burnout. That's kind of a con, but I want to hear some other stuff too.
I think we see the things that people avert their eyes to every day. Specifically in psychiatry, we deal with, at least I deal with a lot of the mental health crises that we talk about. But a lot of times we have these, let me rephrase it in this way. I think when it comes to certain issues and certain diseases, they're not curable. They're how can we help people maintain navigating these different issues as of right now. For example, patients that navigate psychosis. There is no pill that cures their psychosis and they never have to take another pill again. And so we have to be here to continue to provide that support. But it also can feel like you're not doing anything when you're seeing the same patient 15 times in a month. How can I make this patient more stable? What can I do to support this patient? And a lot of times it just feels like, all of your efforts are in vain because you want this patient to do well, but there's a lot of different barriers and factors that are preventing them to do well. And so a lot of times that can be discouraging. But I think what has been helpful to me is just frame it as, my job is to be here when things go bad. It doesn't matter how many times things go bad. I am here to be able to do that. And if I can help you and you leave, that is my success. And I think having to reframe what success means is something that a lot of physicians have to navigate based off of their practicing environment, because there's a lot of different issues. There's a lot of different pain and suffering that we see on a daily basis that we have to try to kind of separate from when it comes to our personal lives.
Okay. How do you see the medical profession evolving, and how can new doctors stay updated in the rapidly advancing field?
Well, medicine is changing rapidly in several ways in particular. The advent of technologies, including artificial intelligence, that can help us gather large amounts of data quickly and look at groups of patients and individuals, but also technologies like wearable technologies that we can monitor patients remotely, whether we can check their heart rate and see if they're having an abnormal heart rhythm, checking their blood sugars remotely, checking patients' conditions, where we don't even necessarily have to be in the same room or same building or even the same city as that person. So utilizing those technologies effectively to improve patient outcomes is going to be something that we continue to learn and grow, because we're seeing that the technology is advancing quickly. But how do we utilize this technology so that we can best serve our patients and the communities that we serve?
Dr. Pettis, do you want to piggyback on that?
I think Dr. Rembert really encapsulated it. The only thing that I would add specifically is the telemedicine aspect of it. Especially in the context of mental health care, when there's a lot of people who are struggling to have access to mental health care, especially in rural environments. This telemedicine piece can allow a lot of providers to be able to spread their umbrellas larger than they really would have been able to do that within an office setting. And so being able to reach more people is something that has been really on my mind as well. And then another thing, talking about the AI, I think there's a lot of gray area when we're kind of navigating these different issues, specifically in psychiatry. You're having the evolution of these AI therapy chatbots. And so I think that there's going to be a lot of pluses and minuses when it comes to a lot of these innovations. And I think that we're going to have to keep a close eye on making sure that these innovations have more efficacy than they have any adverse effects to them.
Okay. What social or ethical issues in healthcare do you believe are most important for current and future physicians to address?
making sure that the those healthcare providers care about the communities that they serve. There are the social determinants of health where we're looking at patients more holistically, their socioeconomic background, uh, race, culture, language, all of these things that we have to take into consideration as we take care of people, because all of that plays a role. If you prescribe someone a medication and they can't afford to pay for that medication, they're not going to take it. If you give them a patient a handout at the end of that office visit and it's not in the language that they speak and read in, they won't be able to understand it. If you can't communicate effectively, and not just in terms of language, but culturally with the patient populations that you serve, you're doing them a disservice, because a lot of times you're missing out on cues, whether it's social, whether it's verbal, whether it's physical, that they're sharing with you about their condition, that if you understand those things better, you will see better patient outcomes, better compliance with instructions and medications. And over time, we can see less hospitalizations, less utilization of health services, because we're getting not only healthier people, but having people who genuinely develop trust in their physician, in their nurses, in their healthcare workers, because they understand that we truly care about them, and not just care about them in terms of them coming and showing up, but care about them culturally, socially, and really trying to affect them in a way that's holistic.
I really want to piggyback on that. I think from a mental health perspective, we have to work on communication. We have to work on understanding the logistics of where we live in today, and looking at that and seeing how we can reach people. I think a lot of times, especially within the mental health space, mental health is used as this catch-all. We need more mental health resources. We need more mental health resources. This is a mental health crisis. But a lot of times we're not defining those things. Are we talking about neurocognitive
Right.
disorders like dementia? We're having a higher geriatric population, so we're having more people navigating these issues and more families having to navigate these issues. Are we talking about suicidality? When we think about firearm deaths, we think about them as far as mass shootings and homicides. 2/3 of the people who die by firearms, those bullets are self-inflicted. So 2/3 of the deaths. And so, really using the data to lead a lot of the conversations that we're having, because a lot of times the public is just not cognizant of what's going on from the data, because a lot of times we are not explaining it to them in a proper way. And I think lastly, really big thing is access to care and what that looks like. I think from a mental health standpoint, we can talk about psychotherapists. How can you find psychotherapists within your area if you live in a rural community? How can you find therapists in your community, even if you live in a city, but you don't live in a part of city with those resources? Or if you live in the city, those resources are already utilized and you have to wait a year for you to kind of enroll within the programs. So these are a lot of different issues, along with insurance and trying to make sure the medications that we prescribe are affordable, because it doesn't matter how effective a medication is. If our patients do not have the access to it, then medication won't be effective for them.
Yeah. I had a doctor on a couple of years ago, and she had a passion about African Americans and STEM. And for those of you all that don't know, STEM stands for science, technology, engineering, and math, or mathematics. And her passion was that there are not a lot of African Americans or Black and brown people that are applying for STEM programs. How do you all feel about that? And the reason why I'm bringing this up, because I know that you have a foundation called the I Am Able, and I wanted to because that's one program that really, reaches out. But I wanted to get you all's views on that.
Can I take this, Dr. Rembert?
Yeah, go for it.
I think it's a pipeline.
Yes.
I think that if you don't have step 1, you cannot be successful at step 4. I think that it's going to take a community involvement, a community intervention for a lot of these different things to happen, which is why me and Dr. Rembert are very heavily involved in mentoring. Because if we're going to try to get this change, we have to be the ones to get our hands dirty and do it.
Yes,
When I was a child in middle school, living in the Whitehaven community of Memphis, I had a unique experience that I was unable to really understand until I got older. I was a part of this science program called SEGME. And so we had this lady, Miss Joyner, who got community members, pharmacists, dentists from the community to meet with us at 5:30 in the morning, because we would get there from 5:30 in the morning to around 7 o'clock to learn and how to navigate these. This is an all-Black school within South. I'm going to say South Memphis. Memphians feel weird about it because South Memphis is a community and not really a geographical area. But just for understanding, I'm going to say that aspect of it. And so that experience changed my life. It told me that, number one, I was actually good at science. And I think a lot of times we don't have that positive feedback to go into a career like STEM because we don't have access to somebody telling us, hey, you're really good at this, keep trying. Two, it built that curiosity. The questions, why? All of those different things are favorable and are needed when you're trying to explore these STEM programs and these STEM careers, because you want to know why so that you can end up finding the answer and then learning the proper ways of how to do research. But we have to instill these things in our community early. We have to instill these into our children early, and then we have to put them in those programs so that they can be exposed and compete. They have to compete because we talk about med school, and a lot of times we talk about it in the same way we talk about undergrad. And you compete there, but you don't compete in the same way, you know? And so I like to compare it to athletics, pro athleticism. You know, these people are training since they were 5. They are in the all of the middle school sports. They're doing the JV varsity, going to college. Like, all of this is not an overnight thing. And so we have to think about STEM in the same way, because if we're not preparing them at 2nd grade, 3rd grade, 4th grade, they are not going to be prepared to do the MCAT, take all of these different extracurriculars when they're ready for this in their college.
Yes, me, I'm a big proponent of STEM, and there was a program I participated in and now have the opportunity of carrying on the legacy called the Chicago Area Health and Medical Careers Program, that was ran by Dr. John Bradley and Dr. Reggie Jones. They were based out of IIT in the 70s and have helped hundreds of underrepresented minorities and others go into medicine, nursing, research, pharmacy, occupational and physical therapy, and other healthcare programs. That program in and of itself has spawned many other programs like I Am Able and other programs that continue on, because in 2016, if I remember correctly, the governor at that time cut the funding for CHAMPS completely. And we struggled, but many of us continue to carry on the legacy and carry on the mission of CHAMPS. In doing so, by mentoring, helping others to follow in our footsteps, helping to open up the doors for medical schools and other healthcare related schools so that we can continue the legacy that Dr. Jones and Dr. Bradley laid out before us.
Let's take a little bit look at this.
I was identified and brought in front of the school board, unbeknownst to me or my family, by the way, for consideration because I was getting in a lot of trouble at the time. And one of the members, Judge O'Neill, he was a school board member and a community attorney at the time, knew Dr. Bradley as personal friends. So when they were talking about sending me over to like alternative school situations, then he said, no, let's send him to Dr. John Bradley. And I didn't know what was about to happen next because I was hanging with a pretty rough crowd at the time. And when, people looking official show up to your door, then you have no idea what's about to happen next.
I learned about the CHAMPS program and realized that certain people that I knew had already been in it and were being blessed by the opportunities. And it was there that I met, I call them the Twin Towers, Dr. John Radley and Dr. Reginald Jones. And it was there that I met Dr. Reginald Jones. And I was a sad, still little girl. And I said, I want to be a doctor. And he says, well, daughter, if you want to be a doctor, you can be a doctor. That was the first time that someone of authority looked in my face and validated that what I dreamed was not too big, that it was actually possible by someone who helped people become doctors. And that was the first time that I actually believed.
I worked with both those gentlemen 35, 40 years ago. They were preparing and helping prepare young African Americans who wanted to become physicians. And people were part of their programs, like Dr. Terry Mason, for example, and other outstanding medical physicians.
When I was in 6th and 7th grade, I lived in Inglewood. And I would see these brethren and Dr. Bradley and other men out in front of a school called Parker, near Kennedy King. I'm a kid, they're protesting. I don't know what they're protesting, but they look crazy to me, So that's how you think as a kid. Lo and behold, a couple years later, didn't know this was Dr. Bradley. He came over to Robeson and said, hey, I'm interested in students becoming physicians. Are there any students here becoming a physician?
So as a 6th grader, I was very active in the sciences and math.
Okay, I had to cut it short because we're losing a little, we're getting low on time, but that's a little bit of Dr. Rembert, tell me, you sent this to me and it says, it's telling a lot about the different programs. I got a chance to see was that Dr. Bradley on there? Or they were talking about Dr. Bradley on that, in that video? But it was showing some, like how African Americans or undeserved people or, minorities are encouraged or I know they get that spark that they can actually go to medical school. Or if they want to be a doctor, they can actually do it. So I wanted to definitely bring that up a little bit. Any thoughts about anything you all want to piggyback on that before we go a little bit further?
I think it all goes back to mentoring again. We have to be a community when it comes to these aspects. I think that we have to reach back in the same way people have reached back for me and the same way that I want to reach back for other people. I think last thing I love to say about mentoring is that it's bi-directional. My mentees motivate me to continue to keep going. I think when we talk about medical school, we don't talk about how many sacrifices that people make, because I think people think about it as equivalent to undergrad when it's that times 1,000. You won't be able to call your family in the same way you used to because you're studying for 12, 14 hours a day because your test exams are paying the bills. And so I think that with that, it can be a lot of pressure and a lot of pain and suffering that you're navigating. But when you see people behind you looking up to you, asking you these hard questions about why are you doing this? I want to be just like you. And you're like, whoa, just like me, like just like you. It puts a little pep in your step. It makes you think about, okay, I have people behind me, so I have to make sure that I'm doing what I need to do. But it also makes you thoughtful about how do you support the people behind you? Because if you're not putting that hand backwards, what is the purpose of it all?
That's it. I'm standing on the shoulders of Dr. Bradley, Dr. Jones, and others that have gone on before me that made those sacrifices to open up the doors for me and others to get where we are. And me and others offer our shoulders up to Dr. Pettis and others who are coming behind us, because they are also going to be the ones to offer up their shoulders for others to stand on, for us to continue to grow.
Okay. Our time is up. I can't believe it. It goes so fast. It goes so fast. But I want to put this up here. This is I Am Able Foundation. Dr. Rembert, can you quickly just kind of tell people about this foundation?
Yes, the I Am Able Foundation was started by Dr. Lamenta Conway. She was in that documentary that we just saw. This is a program that not only provides mentoring services for those who are interested in healthcare professions, including medicine, nursing, physical occupational therapy, but also provides opportunities to prepare not only for the MCAT, the medical college admissions test, but even opportunities to do missions trips abroad. I know later this year they'll be going to Ghana and doing medical missions over
Oh,
there.
wow.
They've gone to Cuba and to other places as well. So just want to make sure that if you are interested in any of the health professions, not just medicine, go to iamable, ABEL.org. I am able, ABEL.org. And please check that out. Myself, Dr. Pettis, and others are involved as mentors and participants in this program because, as I mentioned, this is the legacy that Dr. Bradley, Dr. Jones, that they left. On Monday, the city of Harvey will be giving Dr. Bradley the key to the city at Thornton High School at 7 p.m.
Nice.
And just honoring the work that he's done for a number of decades. We saw Congressman
Yeah.
Danny Davis in that documentary, and others, including myself, who he's touched countless lives, and him and Dr. Jones have touched thousands of people's lives all over the world and helped not only to teach and train and mentor us, but inspire us to continue doing what they've done for decades.
Okay. Well, we did a trivia question. I'm going to do this trivia question, find out who the winner is, and then I'm going to let you two give final thoughts, and then we are out of here. Is that okay? Okay.
Yes.
All right. So the question was, you have severe anemia and you were referred to a blood specialist who ordered more tests to decipher the specific type. The specialist also ordered a blood transfusion and daily multivitamins. Which of these doctors deals specifically with blood problems? The correct answer was hematologist. Do we have a winner, Sherryl?
We sure do.
Who is the winner?
Our winner is Miss Earlsine Gerald.
Miss Gerald, congratulations. Congratulations. I should ask the doctors. I knew they knew what it was, or they would have told it. They would have told it. All right. All right. So, Dr. Rembert, why don't you go? I'll let Dr. Rembert go last. Dr. Pettis, why don't you give some final words, and then I'll let Dr. Rembert take us out.
First, I just want to say it was a pleasure to be on here tonight. It was a really great conversation. Things that I would want people to just take from this conversation is that in order to do medical school, you have to have the proper planning and execution.
Mm-hmm.
And in order to have that, you have to have people and community behind you to be able to help you navigate the issues that you're going through. People have done this before. And so if someone has done it before under harsher conditions, honestly, then you're able to do these things. And I think us as a community have to band together, in a community of psychiatrists, of physicians, of STEM professionals, engineers. We have to band together and start going back to our communities and teaching kids and telling kids that you can be this, because it just takes one person saying that you could be this for someone to believe in themselves and do the necessary requirements for them to achieve these positions.
That's it. I absolutely agree with Dr. Pettis. As a person thinks, so they are. I had to change my mindset growing up from the west side of Chicago, having no one in my family that was a physician. I remember meeting an allergist, an African-American allergist, as a child. And I told him I wanted to be a physician, and he told me, you can do it, but you're going to have to work. You're going to have to roll up your sleeves and study and sacrifice, but you can do it. And when That light bulb went off in my head. There was nothing that was going to stop me. And I want everybody listening and who will listen to this at some point, understand this. The only impediment that you have in achieving what it is that you've been created to do is you. Whether or not you are willing to sacrifice, get up early, stay up late, work hard, study, prepare, and do all those things that you need to do to be successful. Ultimately, it's up to you. And once you realize that you can do it, there's nothing that's going to stop you. Myself, Dr. Pettis, Dr. Carter, we're all shining examples of this. We did not get here by ourselves. We're standing on the shoulders of others who have gone before us and offering our shoulders to others who come behind us so we can continue the legacy of those who open these doors for us. We are literally our grandparents' and our ancestors' wildest dreams come true. At one point, it was illegal for us to be able to read. At one point, it was illegal for us to learn and to gather together as a people. Now, we are leaders all over the world. Now, we are people training and teaching others. And even in the face of the opposition that we see currently, we continue to thrive. So I want to encourage everyone. We can continue to thrive and be our best selves, but it's up to us. Thank you guys for tuning in and checking us out this evening, and looking forward to bigger and better and greater things from all of us. Thank you.
Whew. Y'all leaving us with some heavy stuff. Woo. Thank you so much, Dr. Pettis and Dr. Ronald Rembert Jr. Thank you so much for giving of your time and for sharing the important nuggets about applying to medical school and sharing a little bit of your journey, because there were some very encouraging things that I can, take from what both of you all said. And I'm pretty sure just from some of the comments that I've seen in the chat, people were very inspired by these nuggets. Best wishes in your practices, best wishes on your future endeavors, if it's research, whatever it is. And the mental health, Dr. Pettis, that's a major, to me, that's a major, especially because I'm not trying to say people don't think it's for real, but it is, and it's not really talked about enough. I don't know how to really say it, but it's not talked about enough. It's a real thing. And so best wishes on that. Congratulations on your residency. Best wishes on that. When time permits, I would love to have you guys come back again when I do another health segment. Until next time, I want to let you guys know next week, we were going to have dental students and dentists on here, Beneath the Surface Cracking Dental School. So if you're not busy, come back and hang out with us again there. All right, guys, we are out of here. Have a wonderful weekend, everybody. And as I told you before, the climate that we're in, so be aware of your surroundings, stay prayed up, and be careful out there. All right, we love you. All right, we're out of here, y'all. Say bye.
Thank you, everybody.
Let's go.